Hey guys, Dr. Ryan Hewitt here from Innate Wellness Center. This month, I'm here to talk to you about a serious topic called concussions, post-concussion syndrome, and traumatic brain injury. So let's talk about what to do when you experience a concussion or any sort of head trauma. So the first thing you want to do is always rule out any serious intervention that might be needed. So this means visiting a medical practitioner that will give you a baseline neurological exam and make sure that there isn't any testing necessary like an MRI or any other brain imaging to rule out any serious problems. So once any serious problems have been ruled out, the number one thing you want to do for the nervous system is make sure that you are supporting rest and repair. That means making sure that you get plenty of sleep, make sure you get to bed on time, and make sure you get a full, restful night's sleep. This is where your nervous system recovers its best, that way your hormones can reset and all of that healing can take place. This is also referring to making sure that you are getting some downtime, making sure that you're taking a break from any strenuous activities or anything that would stimulate or aggravate your nervous system. Taking time away from screens, computers, cell phones, tablets, all that kind of stuff, okay? This stuff you just want to get out of your life for a period of time. Number three, you want to calm the nervous system as well, so supporting some of the rest and repair functions. Here's my some of the things that I've observed that work fantastic for doing that. Number one, float therapy. If you've never tried this, there are different float places where basically it's almost a sensory deprivation environment, and it's in salt water, so you float. The water is skin temperature, and it's dark. You know, the calming music. And basically, what you can do is help rest and recover the nervous system. This is also a good time to meditate. So meditation, if you're not going to do any float therapy, just meditating, getting to a quiet place, and doing some breathing techniques. I teach something called box breathing, where it's a inhale through the nose for 5 seconds, a 5-second hold, and then a 5-second release through your mouth, and then a 5-second hold, and you repeat that cycle for a period of time. And again, that oxygenates the nervous system, calms down any stimulus. Number four, consume a diet that has plenty of healthy fats. So for example, wild fatty fish like salmon and tuna and mackerel and things like that. Those have plenty of essential fatty acids like EPA, DHA, which are incredible for making sure that they curb inflammation and also support neurological healing. Other healthy fats like coconut oil, avocado, walnuts, that are just loaded full of those healthy restorative fats. That also implies that your diet has more healthy fats and less sugar. So in videos in this month I'm also going to teach, this is what to do. I'm also going to go over what to take and also what to avoid. So we'll talk more about what to avoid in later videos. Number five, you want to make sure you keep moving. So this implies that you do have plenty of rest and downtime, but also you're supplementing in some movement. So whether it's just walking or just some simple body weight exercises where you're doing some plank holds or some push-ups, things that are very low strenuous, but also make sure they support some of that lymphatic blood flow and make sure it's stimulating the nervous system in a positive way. Lastly, here's something that I'm very passionate about, and I've taken care of plenty of cases of post-concussion syndrome and also traumatic concussion cases. Getting a chiropractic checkup is critical. The reason being is every single case that I've ever taken care of either post-concussion or concussion have had some form of whiplash and neck trauma as well. A lot of these folks, they end up with headaches as well as neck pain, myofascial tension as well as joint restrictions, etc. Getting a chiropractic checkup is critical to make sure that we get a baseline of where you're at and how we can improve restoring optimal function, movement, joint health, as well as restoring all that healthy neurological stimulus from normal range of motion and movement. All right, guys, so this is the what to do if you have any sort of head trauma or concussion. Like I said, later videos, we're going to talk about what to take, also what to avoid. So I hope this helps, and have a great day.